So far this hour, we've discussed how bad COVID is as we speak, and also what Congress could do to actually help people suffering financially if they can get their act together. In this segment, we take a look at how bad things could get. My next guest, he recently penned a piece in the New York Times. You may have seen the headline, "The pandemic could get much, much worse. We must act now." I want to bring that guest in, John Barry. He teaches at Tulane University School of Public Health and Tropical Medicine. He is also the author of the bestseller, The Great Influenza, the story of the deadliest pandemic in history, which is all about 1918. John, it's good talking to you, and we spoke a little bit earlier in the program to Beto O'Rourke, and you in a recent piece you penned in the Times drew a parallel, which is Italy, which I remember you and I talking months ago where people were saying, my God, if we're not careful of Italy.
200 cases a day on average. Population is 60 million, which is triple that of Florida. Florida has been averaging over 10,000 cases a day for a while now. Italy was the epicenter of the pandemic. We all saw the devastation that was there. And strictly through public health measures, they managed to get the cases down. If Florida had done the same thing on a per capita basis, that would be about 65 cases a day compared to over 10,000. You know, the economy would be operating full bore. Football teams would be practicing or ready to practice. Schools would be, nobody would be even debating whether to reopen schools. So we've really botched this.
You also write in your piece, you can't just learn to live with this at these levels, but I want to play for you what the governor of Missouri said just yesterday, which to me is mind-boggling in that here we are in the latter part of July, and it seems like we don't even know the basics of this virus.
These kids have got to get back to school. They're at the lowest risk possible. And if they do get COVID-19, which they will, and they will when they go to school, they're not going to the hospitals. They're not going to have to sit in doctor's office for days. They're going to go home, and they're going to get over it.
To me, this is the part that I don't get, John, which is this is not some town dog catcher. This is the governor that, of course, some kids will get really sick and be hospitalized, but moreover, we all know there's carriers. Even a casual observer knows this. He's not the only governor to say bizarre things. I remember the governor of Georgia was shocked that you could actually transmit the disease. My point is this a crisis of intelligence or just a lack of will? I mean, I drew parallels to your book. It seemed in 1918 we had more of a public, even with science being far behind for where we are now, there was a better willingness to sacrifice and do the harder things then than now.
The first sentence of that op-ed you referred to said, when you mix politics and science, you get politics. This is 100% about politics. It's got nothing to do with people's lives, trying to save people's lives, nor does it have anything to do really with trying to get the economy going again. As we were just saying, if you get the cases down, the economy comes back 100%. But you got to get the cases down. We've lost everything, all the pain that we all went through in March and April. In too many states, they've lost most of that. In some cases, all of the advantages that they had gained. It's incomprehensible that someone would say something like that. Technically, it's true. Yeah, most of the kids are not going to get seriously ill, but you got teachers, you got people working in the schools besides teachers, you got grandparents, you got all that, and I think everybody in the audience knows that. It is important to get schools back. Everybody wants to. I want to. The kids want to. The teachers want to. But you have to do it in a manner that is safe. And you can do that. But the key to it is getting the community transmission down.
Curious, given the knowledge of history that you have and given all the public warnings that went unheeded and what might happen, as you say, if we're not careful in the fall and winter, are you more mad that we're in this situation or are you more worried what could be?
Well, that's a great choice. It is infuriating to realize that tens of thousands of people died who could be alive right now. and that thousands and possibly tens of thousands more people who could survive untouched will die. You know, the concern about what happens when the weather gets colder, if we don't get the baseline down, that's even more troubling. We haven't gotten the contact tracing and the isolation and so forth. We haven't built that infrastructure. If it takes 5, 6, 7 days for a test result, it's useless in terms of contact tracing. If you get the cases down, then you can do all those things, and you can reopen the economy more or less fully, although you would need to maintain precautions and distancing and so forth. So I'm not sure that I answered your question. I'm both infuriated and worried.
I think you did. Well, again, if you want to get a look, and it's a haunting one because it's so eerily pressing to where we are now, read John's book. I did. It's called The Great Influenza. It's a terrific read here and a frightening one. But John, I appreciate a few minutes as always. Thank you.
Well, thank you very much, and good luck.
We'll need it. All right, when we come back, we're going to show you some personal stories of Americans that we lost far too soon, lost into COVID.